Good morning, everybody.
Good
Morning.
morning. So as we get started, I invite everyone as a way of introducing yourself to put your name, your organization, and I always ask where people were born and raised. And so
Oh,
I'm a proud Dorchester girl. And if you don't mind sharing where in fact maybe you were born and raised, way of building community, and you might find some surprises where we grew up in the same town. All right. So,
NYC. I can see that, Dr. Padel. I can see NYC for you. This is a good question, Candace. All right.
Ashley, whenever you're ready to share screen, we can.
Excellent. I'll do that now. Thank you.
So we have a pretty packed agenda, and I'm realizing I should go back and introduce myself again. Candace Burns, Director of Inclusion and Workforce Development at Dana-Farber Cancer Institute. Happy fall, everybody. And welcome to our September Boston Healthcare Careers Consortium. Really excited to have each and every one of you here. As I was saying, we have a packed agenda, which will start with, next slide, which will start with a whole bunch of announcements. Following that, we will move into some great updates as it relates to our school to career program highlights and takeaways. And then we'll wrap up with next steps. Okay. So as you continue to come in, introduce yourself in the chat, the organization that you represent, and where you were born and raised. Again, I said earlier, I'm a proud Dorchester girl. We're going to move right into the announcements. So really excited to introduce Abigail Cross, Assistant Deputy Director of Special Initiatives and Grants Management at the Mayor's Office of Workforce Development. Abigail's going to share an announcement about Good Jobs Challenge wraparound support funding. So with that, I'll turn it over to Abigail.
Hi, thank you. So as Candace just said, I'm Abigail Cross, and I support the City of Boston's Good Jobs Challenge grant for the Office of Workforce Development with my colleague Saida, who's also on the call. So I just wanted to do a quick announcement. So within the next few weeks, we'll be launching a request for grant applications to support the provision of wraparound supports for training opportunities within the healthcare sector and the other sectors that we're supporting through this grant. And to provide a bit of context to this, we set aside approximately $1 million in administrative funding to provide wraparound services to Good Jobs Metro Boston Coalition participants, and we've so far allocated just under $400,000 to 6 partner organizations who use the Unite Us platform to submit requests for wraparound supports and backup documentation for their invoices. The eligible services under this request for grant applications will include transportation, childcare, food, clothing and supplies, communications, ESOL services, and education support services. And funding is limited to an average of $500 per participant served. So while we're unable to provide direct stipends or participant wages, we think this is a great opportunity to support job seekers through training and placement opportunities in sort of expanding the footprint of the Good Jobs Challenge. So just wanted to do a quick announcement. The request for grant applications will be released within the next few weeks and should be posted on our website. And then I can send the link to Ashley for the newsletter.
Fantastic. Thank you so much, Abigail. I want to open it up to for questions. Does anyone have any questions in regards to this?
Abigail, could you maybe share more about if folks got this funding, what reporting back looks like and like the ultimate way that this also supports the work of the Good Jobs Challenge grant?
Yeah, so reporting back would look like, so you would have to report on each of the participants served through the Unite Us platform, and for our training provider data instrument to the EDA. What that looks like is you would provide participant information, a list of the participants, when they entered the training, when they got a job and completed the training, as well as their address and demographic information. And in the aggregate, you would just provide, a number of, participants engaged, recruited, enrolled, and, their job outcomes for each quarter, and then 6 months after they complete the training. And I think this can support the Good Jobs Challenge through, basically expanding the footprint. We have, these dollars that are currently unallocated, and, we think it's a great opportunity to serve more participants through and, support, placement and retention into the jobs.
Great, thank you. Any other questions before we move on?
One came through in the chat.
Yeah, I see that. So it's, is there any funding available to support the administrative capacity that will require? That's something that we're still working out. So I will definitely, let you know, but I don't want to say anything that out of turn. But yeah, that's something that we're still working out.
Okay. Thank you so much, Abigail, for that information. Appreciate it. So we're now going to transition it over to Kim McLaughlin. Kim is a workforce development consultant serving as part of the UMass Global team for the Good Jobs Challenge grant. Kim, you have an announcement for us?
I do. I didn't realize I was speaking. Ashley, what am I speaking about?
Oh, sorry, about the job fair. If you'd like me to share, I can share.
Okay. Yes. So yeah, why don't you start and then I will jump in. Sorry about that.
Nope, that's okay. You got it. So I got news from UMass Global. They're going to be hosting a job fair on Friday, October 4th from 11 a.m. to 4 p.m. at the Boston Marriott Copley Place on Huntington Ave. They can accommodate up to 15 hiring managers. It's going to be first come, first serve for the hiring managers. It's open to all healthcare organizations. They're hoping to get confirmation from employers by Friday, September 20th. And Reagan Forlenzo will serve as a point of contact. I'll make sure to put all of this in both the chat and in the follow-up newsletter. But they have over 500 applicants ready for medical assistant and patient care technician roles. And we can try to answer any questions between Kim and I from
Yes.
what we know. But otherwise, just wanted to announce this and share the opportunity for folks to join the job fair, and we'll be sure to send out information in the newsletter as well.
This is Joanne. I think it would be helpful to understand what kind of training these folks have had and if they've had hands-on training. So as part of sharing the information, I think that would be great.
Yeah. Do you want me to answer? Do you want me to go with that, Ashley?
Sure.
Yes. So this is part of the Good Jobs Challenge. And we've been working mainly with Mass General, Brigham, and as Ashley said, doing the training for medical assistant and patient care tech and doing the didactic part. And then there's a clinical component of it. And what we're doing with the job fair is piggybacking the clinical, which is held in a hotel in Boston. We do those monthly. They're 8 hours. There's a regular clinic and an advanced clinic. Many of the participants are participating in several clinics. And so that's what we're doing. What we've also started doing the last couple months is, as part of that clinic, is we're doing resume development the day before. So the clinics are on Saturdays and Sundays. So this is on a Friday. So at the same time that we're kind of piloting this job fair to get employers there, they're working on resumes. So could well be that participants will be updating resumes and then going next door and possibly meeting with employers.
Thanks.
Sure.
Excellent. Any other questions? Kim and Ashley, thank you so much for that update. Really appreciate it. So with that, I get to now turn it over to Angela for the next announcement. Angela McCabe.
Yeah,
Okay.
what's my announcement, actually? Sorry, I don't have the agenda in front of me. Is this the Carney?
This is Jeff.
Jeff?
Yeah.
Oh, I'm sorry. I wasn't sure if that was announced. Where is he? I can see him down on the bottom of my screen. Welcome back, Jeff O'Connor. Jeff has been with us before in many iterations, and I don't know how far you want me to go back, Jeff, without really making you look old.
Yeah,
But his current role is now the workforce manager at the Tufts Medical Center. I can't say anything that people don't already know. Well, I could, but I won't. So, Jeff, would you like to introduce yourself to those who don't already know you?
Oh, thank you so much, Angela. It's good to be back. So Jeff Vercotterin, I'm the System Director of Workforce Development at Tufts Medicine. I am on day 4 right now. So I really have no idea what's happening. I don't know even, but I am so happy to be back. Geez, it's been like probably about 7 years since I've been at one of these meetings. And I'm really happy to see everyone again and meet folks for the first time. So I'm going to be responsible for coordinating workforce development activities across the Tufts Medicine system, including Tufts Medical Center. And yeah, I'm right now just in a drinking from the fire hose stage. So just trying to learn what's going on at all of our entities, trying to make some connections, but please reach out. I'm happy to talk to folks. I really want to know what's happening in the city. I want to know what's happening in the state, in the region. So I'm thrilled to be back. It's so great. And Candace, it's great to see you as chair. I had no idea. So
No, I'm not chair. I'm just facilitating the meeting.
okay. So as I guess head facilitator in charge. So
It's great to see you back too.
yeah, thank you.
Okay, the next update was on Carney Hospital. We asked the state to come, the rapid response team to come talk with us. They were unable to do that today. But just a quick update that Carney, as you know, Carney and Neshoba Valley have closed. With Carney, there's just over 750 people who are being laid off. Rapid response has stepped in. They did 2 job fairs at Carney Hospital to help the staff find placements. Many of you, I think, were involved in that. There will be another job fair on September, I believe, 26th, but we'll put it out after this. And it will be held at the Sheet Metal Workers Union, which is near Carney. The career centers are helping out with this. I believe it is a closed job fair for the Carney staff that are leaving. And at the next meeting, we hope to have the rapid response team come talk about the demographics and the placement information of those that got jobs. We will keep through the newsletter. We will keep up with any other events that are happening for Carney. And at that, I will hand it to Joanne.
Thanks, Angela. I have a quick announcement. So some of you might know I chair the State Workforce Board, and we have a meeting coming up next week. And the focus of that meeting is on healthcare. So we want to talk about what is the Healy Driscoll administration strategy around the healthcare workforce. We are going to have Joanne Marquesi there to talk. We're also hoping to hear from the higher ed task force on the nursing workforce. So it's a public meeting, and I wanted to make sure people who are interested had the ability to come. So again, it's Thursday the 19th, 9:30 to 11:30, and Ashley will send out the link to that meeting and that meeting information following this meeting. Thank you. Oh, and then I get to kick into the next agenda item. All right, pivoting. It's back to school time, and we wanted to take some time to hear from some of our academic partners and consider what we can learn from various programs and partners across the region who work with high school and college students. And so first, we're going to hear from Lila Jalilian to review the healthcare summer internships. So Lila, take it away.
Thanks so much for the warm welcome, Joanne. On behalf of the Boston PIC and all the students who interned this summer, I wanted to give a big thank you to our hospital partners for your continued support and eagerness to work with our students year after year. This summer, in partnership with Boston Public Schools and the Mayor's Office, we placed 294 students from 25 different Boston Public high schools at 9 hospitals across our city. Our top 3 employers were Brigham and Women's Hospital, Dana-Farber Cancer Institute, and Mass General Hospital. This year's number is down by 95 placements from last summer, just a little bit of slippage, but we recognize that it will take some time to return to these pre-pandemic numbers, which were over 500 placements in the healthcare field. We are determined to get those numbers back up, knowing that we have a long history of working together to provide enriching opportunities for our students. And together, we know we're building a stronger, more accessible school to career pipeline. I also wanted to highlight that Mayor Wu actually visited our interns at Dana-Farber this summer, which was super exciting. She had the opportunity to see them in action, working in their departments, and was also able to witness firsthand the impact that these internships have on our students and their futures. Also, a big shout out to the hospitals for hosting such wonderful closing ceremonies at the end of the program, celebrating both the students and their departments for all of their collective achievements. We had some amazing student speakers, some amazing hospital speakers. It was such a great experience for partners, for students, for everyone. Just as a quick note, the PIC Employer Engagement Team will be hosting our next Employer Network meeting on November 13th, where we'll be reviewing this past summer and plans for an even better summer 2025. A calendar hold and further details will come later this week. Thanks so much for collaborating with us this year. Back to you, Ashley.
Oh, and I'm gonna take it back, actually. So thank you, Lila, and thanks to all the healthcare employers who hosted students. I know I went to our closing ceremony at BIDMC, and one thing that really struck me was how many people talked about how they were new to this country, and sort of the shifting population of the Boston Public Schools. But to a person, they were very grateful for the experience that they had in the summer. So next, we'd like to invite Michelle Keenan, Director of Community Engagement at Harvard Medical School, to share out about some of the longstanding programs that Harvard Medical School offers and their learnings and best practices developed along the way. So Michelle.
Thank you, Joanne. And it's a pleasure to be with you all. Many of you I've known for many years, and it's always great to be amongst friends. Shout out to Jeff. Thrilled that you've returned to the group. That's great. So what as Joanne mentioned, I'm Director of Community Engagement and Education. I work in the Office of Diversity, Inclusion, and Community Partnership at HMS, and thank you to Ashley for driving the slides. In my time with you today, I'm going to give a very brief introduction to Harvard Medical School. Some people are more familiar than others, so I thought that would be helpful. I'm going to talk about some of our pathway programs, particularly around the high school years, but we also lead into college, and just some things that I've been reflecting on, kind of learnings and reflection on system opportunities. Thank you. You too, Candace. Great to see you. So Harvard Medical School, people, if you talk to most people, they're like, that's where they train doctors, and we absolutely do train doctors. But Harvard Medical School, it's very design is with connected to 15 affiliated health institutions. It doesn't have its own hospital, as some medical schools do, but this just gives you an illustration of our 15 health institutions that we're affiliated with. And so when we talk about Harvard Medical School faculty, they, in addition to some that are on the quad on the campus, they're basically distributed across all these health institutions. And as you can see, there's, you know, many of our major hospitals are on there. For full-time faculty on campus and at affiliates, it's over 10,000, about 10,500. These are FY23 numbers. And just to give you an idea of, you know, how large our student body is, you know, in 23, we had 710 MDs, 908 doing PhD programs. We had dental, we have a dental school actually on the campus, and 559 master's students. So I often mention that because we have a lot of science research programs, graduate programs underway, with many students. That's a large part of the student body. Next slide, please. Oh, you know, the other thing I should mention, because people often think, oh, Harvard's in Cambridge. The medical school is actually in Mission Hill. It's right there on Huntington. It kind of is between Huntington Ave and Longwood, predominantly on Longwood. So that's where we're located. And the Countway Library is on Huntington Ave, just near Brigham Circle in Mission Hill. It's surrounded by hospitals, as you all appreciate. So I just wanted to mention a couple of pathway programs. One is one that just concluded a couple of weeks ago, Project Success. This is a program where juniors and seniors get paid summer research internships, specifically in labs with HMS and HMS hospital labs. They're really responsible for a project over the course of the summer. We recruit from Boston and Cambridge with a particular emphasis on those underrepresented in STEM or disadvantaged. And they also have common summer learning experiences. So it's really like it's a strong immersion program into labs. Students are attracted to it. They both have healthcare, or some of them are like, I really want to do research in my career. I'm really curious to explore that further. One I also want to mention, and I'll in the chat when I conclude, I'll make sure I put the link to this because the applications are due on September 20th. This is it's called the HPrep program, Health Professions Recruitment and Exposure Program. And it starts in early November. It's a free 10-week program on Saturdays. Students are not paid on this one, but they do receive money for travel. And 9th to 10th grade students basically get a Saturday of working with healthcare professionals, interactive experiences. They also can do a project of their choosing, you know, on a health or science topic, and they get one-on-one mentoring from graduate students or medical student at the campus. It's a remarkable, it's 70 students participate, and it's all student run. So very supportive of that. And it draws students from Greater Boston with a particular desire to serve those who are underrepresented or underserved. But I'll make sure I include the link. Next slide, please. The other thing I wanted to share with you, because this is very familiar to some of you and not so familiar to others, I imagine. Within our Office of Diversity, Inclusion, and Community Partnership, we actually nested in there is a nonprofit, which is called the Biomedical Science Careers Program. People commonly refer to it as BSCP. You'll often hear the acronym much more than the long name. It was established by Dr. Joan Reed, Dean Joan Reed, and it was established in a quite visionary way in 1991. So it's been going for quite a number of years. And the real emphasis is how do we increase representation of underrepresented and disadvantaged individuals and throughout science and medicine? What would a entity like that look that kind of crossed hospitals, healthcare institutions, private industry, and education? So that's the focus. Next slide, please. So what BSCP does is provide a whole lot of different opportunities where the community can network and connect with one another, but also connect with employers, connect with people who can help give guidance and help shape their resume, a lot of practical support, but also a lot of bringing people together around particular sessions or information sessions, both virtual and in person. And since it was established in 1991, over 15,000 students have participated, and also numerous, as you can see, postdoctoral trainees and early career professionals. It's national, but we do get, BSCP gets a lot of participation within the New England area. Next slide. So up and coming for the Biomedical Science Careers Program, the one coming up in October 26th is a skills workshop. It's that's actually run through our department. It's kind of a joint BSCP and our Office of Diversity and Inclusion effort. And this is a free event, takes place at Harvard Medical School, and the workshops include cover letters, resume preparation, interviewing skills, 10th to 12th grade high school students, but also college students are welcome. And the groups are split up. So the kind of guidance they're getting is appropriate for their kind of where they are in their educational trajectory. A lot of sessions on financing your education and how to apply for the older students, how to apply for medical, dental, graduate school opportunities. Also in this session too, we make sure that we have information sessions for parents and caregivers. And there's also an internship fair. So the parents and caregivers tend to be more for the high school group, but giving them information as well. And that is actually the applications for that will be opening extremely soon. So I'll make sure in the summary that I provide, Ashley, that you have the link and you can send it to anyone. And it does fill up very, very quickly. In March, there's a 2-day, every 2 years, BSCP runs a 2-day conference. This is really broadly attended. It's a very large meeting, and the workshops are really tailored to the academic level, but the emphasis is on, building your understanding, getting connected, and resources on additional job opportunities, internships, research opportunities from a whole range of public and private partners. There's also in late March, on March 30th, there's a New England Science Symposium. If you know people who perhaps they've presented at a conference, perhaps they've never presented at a conference, they're science, healthcare, health science focused, and they really want a great opportunity to learn how to do that, engage with that, and share their findings. This is I would encourage them to think about the New England Science Symposium. It's quite distinct, very, very diverse participation in that particular symposium. And there's a lot of support given in advance. So you get feedback on your abstract in advance. You can participate in a feedback abstract session. So you can kind of hone it and strengthen your abstract. So really it is on skill building and also sharing people's knowledge. And I think, Candace, have you been to, you've been to some of these, I would imagine.
Oh, yeah.
Yeah.
They're excellent.
All of them. So, yeah. Next slide. And I wanted to share those. I talked to BSCP colleagues because there's some great opportunities coming up. So I'll include that in the summary. Ashley asked me to talk a little bit about learnings and reflections, and I just said early and often. So I can't underestimate, and I think so many people share this view, that opportunities in middle and high school years build a foundation for future pursuits. And it sort of plants the seed. Well, I could do that. Well, I'm meeting someone who I can connect with who's doing that. I can do that. And that just goes such a long way. But the continuity, and this is something that at times troubles me, and I try to think about like greater continuity of support, because people are in programs, they depart, you keep in contact, you let them know about opportunities, but what would something with greater continuity of support look like? And this is where I think for me, the biomedical science careers program becomes fairly important, because I know if someone's attending one of those, they'll then get the newsletter, they'll find out about additional information and be able to participate in virtual and in-person sessions. So they're sort of stay in the group. And I also reflect on this, people's career trajectory, educational trajectory is not at all necessarily linear, and where are the on-ramps and off-ramps? So somebody's pursued something, things change, or they don't want to pursue that further. How do they, it's making sure they have good mentorship so they can talk through, as their decisions evolve. But also where do we pick up people that really have had a disjuncture, either educationally or in their career opportunity. The other thing I'll mention, this kind of led up to last summer, we meet with what are called the diversity affiliates groups. So those are folks who are working in diversity, inclusion, equity work at the hospitals, that we work with at the health institutions. And everybody had kind of, different programs and stuff. And it just became apparent that, one of the things we could do, it took a chunk of time, but it was worth it, was just kind of consolidate all the information. So we put together, basically a list of the hospital-based programs at different age, going from high school all the way up into medical school, hospital, and Harvard programs. And that's proved to be really helpful to people who are looking for opportunities, because as you can imagine, there's so many different websites and so many different places you need to look. And I'm going to, that's also a link I'm going to put in the chat, because I think it could be helpful to you. It was updated as in advance of last summer, and we'll be reaching out to all programs to make sure it's up to date. So, and I actually put that on the BSCP website, because we want it to be broadly available. And the other reflection I have is, what could we do more collectively to raise awareness of program opportunities? I just think that we could think more creatively about that. I know I could, and I've always appreciated the opportunity. We did a great joint program actually with a session over the summer with our students, Dana-Farber's students in the CURE program, as well as the MGH Neuro and research program. But what if we, there's so many challenges in the environment. It's like anything that we can do collectively saves effort and actually restores kind of strength, I think, to everybody if we actually tackle things together. And could we think more about two-generation approaches? So people are working with adults, and do they have young family members who could benefit for these programs? Is there anything we could do together, even as a trial? Even just piloting something with two-generation approaches. So that's what I wanted to share with you. I'm happy to take questions, but I want to be respectful of the time on the agenda. And I will include 2 links as well in the chat.
Thank you so much, Michelle. Does anyone have any questions for Michelle right now? Sounds like she's going to answer a lot of them with the resources she's providing, and we really appreciate that, Michelle. It's awesome work. It's great.
And not a question, but more so a comment in regards to really appreciating your thought around sort of how do we collectively, come together and share resources. I know that, and during the pandemic, multiple hospitals came together for the healthcare consortium workshop. And so BI Deaconess was at the table, Children's, Dana-Farber, MGB, Tufts. And it was really awesome. And we were aggressive with, our first 3 years with meeting every week with all of these collective students coming together. This year, we simply did a leadership forum, but again, so well received by the students that participated. So I'm loving that thought around collective work.
And I'll just add, you know, I think a lot of us are so focused on the summer and providing that summer experience, and how do we weave? I love your idea of more continuity and like one message around, all right, after the summer, here's what you can do. Here are the other opportunities and that sort of thing. And I think we could all get better at that message. Thanks.
Thanks so much. And Shrin? There's another hand up I just saw.
I think she just put it down as well.
Oh,
Yes.
okay. Well, segueing from that, I just think the power of this group working together continues to be just really amazing, getting a lot of things done. And I love the way that we can travel over borders and barriers and between employers. So welcome back, Jeff. Hi, Michelle. We have people that have definitely moved around, and that's my great pleasure right now to introduce the newest MGB member, Kristen Driscoll. We're so excited that we could lure her from a great place to another place because of her expertise in working with young people, her passion for making things happen and creating pipelines. Kristen's our new director at MGB for the Bloomberg Healthcare Initiative, working very closely with our partners, Edward M. Kennedy Academy, the Office of the Mayor, Boston Public Schools, and the Bloomberg Philanthropies, and many others are in there. So Kristen's herding a lot of cats these days. It's very interesting to watch, and very grateful that it's not me. I'm grateful that I'm watching, which is the best part of this whole introduction. So welcome, Kristen. It's the importance of the right person in the right role cannot be explained louder here. So welcome, Kristen, and I'm looking forward to hearing about the EMK updates. Thanks.
Thank you. Good morning, everyone. I have a couple slides I'd love to share with folks. Oops, hold on. Thanks for that introduction, MJ. That I appreciate that. Very excited to be in this role, missing my Boston Children's colleagues, of course. Yesterday, we had an incredible kickoff event celebrating back to school for the EMK students. Lila and Jimmy from the PIC were there, so thank you so much. You may see some, hopefully some media quick coverage on that featuring one of the students, which is awesome. So I just want to share really high level what we're going to be doing in the Bloomberg work, because we're really getting started. This incoming freshman class, the class of 2028, is the first group that will be part of this initiative. So hoping that we can come back to this group maybe in a year or so to update folks on, you know, how the first year went, lessons learned, and the planning that we're going to be continuing to do over the next couple of years. So just sharing a little bit to build on what MJ just shared. MGB has had, you know, over 2 decades of relationships with Boston Public Schools, EMK as well. So the goal is that this project would really build on all of the incredible work that's been led by many people on this call that MGB has had in the youth program space. Really, what I want to bring your attention to is that the Bloomberg funds will allow us to take the partnership with EMK to the next level. We will be refreshing one CTE pathway that the school already has and adding 2 other CTE pathways, but officially 4 MGB health career focused pathways. We will also be increasing the enrollment of the school from 400 to 800 over the next 4 years. So that actually is going through school committee right now. If folks are watching school committee at night, it was last night that a presentation went before them. So that's in progress. All right, so a little bit about EMK for those that might not know. EMK started as Health Careers Academy, has been around since 1995, is in late 90s became a Horace Mann charter school, which means that it's an in-district charter school. In Massachusetts, there's 2 types of charter schools, Commonwealth Charter and Horace Mann Charter. So that definitely means for EMK that they're part of Boston Public Schools, but have some special designation with the Horace Mann Charter status, and that brings some different rules and policies. In 2012, the school actually expanded from 200 to 400. So since 2012, they've been in 2 campuses. So they have 9th and 10th in one building and 11th and 12th in another building, miles apart. And for all of us that, you know, live in Boston, a couple miles is a pretty big, it's significant when you're dealing with traffic and transportation. So one of the critical pieces of the Bloomberg work will be bringing the 2 schools together in a permanent space for the school. So that will be really critical and really exciting for both the students and the staff. Also wanted to highlight some of the things that we're working on right now. Some of these items I've already shared, but just bigger picture, the Bloomberg philanthropic donation is part of a larger multi-geography strategy that the Bloomberg Philanthropies is implementing over the next 6 years. So we have partner sites in Houston, Dallas, Durham, the state of Tennessee, New York. I think that's all of the geographies. And all of these geographies are partnering with a school or a school district. They are either transforming a current school, building a new school, but the key here is that we are adding career and technical education to that school model. So for EMK, they have had a CT, career and technical education path for the last couple of years with nursing, health assisting is officially what it's called, but that's a pathway that enables students to earn their CNA. For some of the other geographies, they will be starting from scratch and building these CTE pathways. I think one thing that's important to highlight when we talk about the different paths that MGB is interested in that are listed here on the slide is that the DESE framework requires that we build off of the CTE, the career and technical education curriculums. So that's really the first part that students will be learning and then having hands-on experience to do. And then the model will mean that students will then have additional modules and curriculum that will allow them to become a medical imaging aid, for example, or a med lab science entry-level tech position. So that's kind of the strategy here, is that it's like a stackable piece where they're first start with the state credentials and then add on more of the hands-on skills that the hospitals would be looking for. I think just to last mention here is that our project is a 6-year grant with really a longer 10-year strategy of how we're going to do this work and lift this project up. But I think one of the things the team has been talking about a lot is that transition, right, from high school to college. That is not a surprise to anyone on this call, but that's an area where we're really planning to build out graduate supports and helping to bridge that gap for some of the students that our data is showing us have not been able to be successful, maybe enroll in college, but aren't able to persist. So really thinking about how can we support that group of students to help them transition into careers at MGB and potentially continue to pursue higher education if that's something that they want to do. So I think this is my last slide here, but I just want to give you a visual of what are the components of the project and what are we working on right now. So in fall 2024, we will be doing a combination of classroom visits with guest speakers from MGB. And then in January, in the second half of the school year, we'll be hosting students on site for 3 full-day career exploration site visits. And that will also include simulation. And then as the project progresses, we'll move on to being able to have some type of clinical placement and for students after they meet those state requirements, or in some cases as part of their state requirement. And then certainly, we'll be encouraging students to continue in any type of after school or summer job opportunity. So happy to answer any questions or anything folks want me to go into more detail about, but thank you for allowing me to have the opportunity to talk with you all today.
Well done, Kristen. Thank you so much. Any questions? All right. Again, thank you, thank you, thank you. So proud to be working with you.
Thank you. Thanks all.
I learned a lot. Thank you so much. Good to see you, Kristen, working on our team and having that MGB banner behind you. We look forward to having you and your team back again to present when the project is further underway. And as a wrap up to our educational spotlight today, we'd like to welcome Dr. David Podell, president of Mass Bay Community College, to discuss the impacts of Mass Educate and Mass Reconnect, along with the initiatives at Mass Bay and other community colleges.
Thank you.
Thank you for being here.
Pleasure to be here. A lot has been happening in the community college space in the last couple of years, as many of you know, but just to bring everybody up to date, community colleges have been seeing a gradual diminution of enrollment since the Great Recession. And that was because of a demographic shift that were fewer and fewer 18-year-olds entering into our colleges. That was reversed, and then of course it fell further during the pandemic. That was reversed when Governor Healy introduced Mass Reconnect in her first year. And Mass Reconnect was a program that would make community college education free for anyone who was 25 or over, who had a Massachusetts high school diploma or the equivalent, was taking at least 2 courses, 6 credits, and completed a FAFSA. And part of the goal here was to maximize the amount of federal financial aid, Pell, that students could bring in. And that led to the first boost in community college enrollment in years, in a decade or more. System-wide, for the 15 community colleges, it meant an 8% increase. At my particular college, which is Mass Bay Community College, we went up 14% last fall as a result of Mass Reconnect. And a big chunk of that boost was in health science, or let's call it pre-health science studies, people who were planning to take the prerequisite courses that would get them ready for, let's say, nursing. Also last fall, in addition to Mass Reconnect, the Senate president introduced free nursing education for community college students. And that was a great boon for people coming into the field. It meant they wouldn't have debt at the end of their studies. And it also meant that students who maybe had never thought of going into nursing because they just figured it was too expensive would now have the option of doing it. It didn't solve the nursing shortage, obviously, because there were so many other factors at work. I don't have to tell you, the lack of clinical placements being the major factor that inhibits us from graduating more, educating and graduating more nurses, but also a dearth of faculty, because we've had trouble attracting faculty to teach in nursing programs, in part because our salaries are not as good as your salaries for nurses. We're constrained by a union contract that doesn't allow us to deviate very much based on people's experience in the field, which you want them to have if they're going to teach nursing. So the free nursing program was great, but it didn't solve our problems. This year, the Senate president advocated, and it came into law, the governor signed it on July 19th, Mass Educate, which is based on the notion of free community college for all, with all the qualifications that I just said. You have to be a Massachusetts resident, complete a FAFSA, take at least 2 courses. And that's led, it's too early to know the percentage increase system-wide, but at Mass Bay, and we may be kind of a typical example, that's led to a 17% increase in enrollment, and literally a 50% increase in health science enrollment. So that's people going into our health science programs and our pre-health science programs. That's huge. And if that's true in the other community colleges, it means we have a lot of people entering the pipeline. But we know that the pipeline is constrained by all the factors just noted. You might be interested to know that right now, 50% of our students are under either Mass Educate or Mass Reconnect. Both programs continue to exist, depending on whether you're over or under 25. So that's half of our students are getting free community college through those programs. And in this way, Massachusetts is really a leader. There are some other states in the country that have forms of community college, but this is really a progressive program. It also comes with funds to support students with their books and supplies and other costs, about $1,200, which isn't a fortune, but it helps. I have to say, in my lifetime, a turning point in how community colleges are viewed as a part of the puzzle in solving the crises in staffing, not just in health science, but in other fields as well. We used to hear about free public college way back. My parents went to college for free at City College of New York in the early 50s. And that vanished as tuition was imposed and more fees. So to get back to a free opportunity is really tremendous. And we won't fully know the impact for a little while. I can tell you that at Mass Bay, we've just doubled our associate degree in nursing program. It's not one of the biggest in the state, but we typically had 32 a year. Now we're admitting 64 a year. And that will help. And that we've been able to accomplish through a grant from the state that's been interested in addressing the nursing shortage. And we've been successful in hiring more faculty to teach these students. So our class just doubled. It'll take them 3 years to get through, probably 2 to 3, depending on what their prior coursework is, but it's something. I also want people to be aware of another initiative that's happening at 4 of the community colleges so far, and soon at others. And this is no surprise to several of you who are participating in this with us. And that is the Smith Family Foundation, aided by the organization called Accelerate the Future, is providing funding to 4 community colleges, Mass Bay, Middlesex, Quinsigamond, and Bunker Hill, to introduce apprenticeships as a strategy, as a new strategy to try to address the workforce crisis. Now, the colleges are each doing different programs to introduce apprenticeships, but surgical technology is a common one among, I think it is 3 of the 4 community colleges. And behavioral health is also in multiple community colleges. Mass Bay is going to work on behavioral health and surgical technology. It's very complicated. Apprenticeship is a long-standing tradition going back to medieval Europe, you know, for cobblers and other professions. It's continued in the 20th and 21st century in what we call the trades, but introducing it into healthcare careers is complicated for a myriad of reasons. And it clearly needs employer buy-in, literally financial buy-in and partnership with community colleges to make it work. We're just learning how complex it is, but we're going to pursue it and see if it can be a model, because we've tried so many other things, but maybe this is a model to get more people into the workforce in healthcare jobs who will then stay and not be bouncing around, and alleviate. And there's not going to be any single bullet, but if this could ameliorate the crisis, that would be fantastic. So that's a quick overview. To summarize, community colleges are on an upswing in enrollment, a lot of it in healthcare professions. We still face the same obstacles of the past. We are very, very grateful to our healthcare partners, so many of you in the room, who are working with us to get students educated, get them in the field. I'm also delighted that the consortium is going to meet in a couple of months at our brand new health science building in Framingham, which the state funded a couple of years ago, and it finally opened this past January. And it's I hate to overuse this expression, but a state-of-the-art facility, I think you'll agree when you see it, because many times people from hospitals come in and say, we don't have this equipment yet in radiological technology or sonography or whatever, with a very, very strong simulation center with AI informed mannequins. Kind of scary because they talk to you and they'll tell your name, they'll speak your name, and they may change languages on you. But in any event, I look forward to hosting you there and having you all see that facility. So happy to answer any questions, or please feel free to email me with your questions. I'll put my email in the chat if questions come up later. Thanks very much.
Thank you so much, Dr. Podell. This is such an exciting time for the community colleges and for the opportunities created for your students and employers. I had the chance to visit the new campus earlier this summer, along with several of you on the screen, and it's beautiful. So mark your calendars, plan to attend. It's a really beautiful place to see and experience what's happening at the school. So over to Ashley.
Well,
we
got
have
a
a
question
question
on
from
Joanne.
Joanne.
Yeah.
Sorry.
Yeah.
Joanne has a question.
I have just more of a comment that thank you, Dr. Pradell. That was such great information and information I hadn't heard before around the impact of Mass Reconnect, the impact of Mass Educate. I'm so excited that you're doubling the size of your nursing program. Amazing. So, thank you for sharing all that information with us.
Thanks, Joanne. And I note that Kristen has put in some information about Bunker Hill that I hope people will read, because Bunker Hill is also doing heroic work to try to address the shortage.
I figured I'd put it in writing, but I also wanted to mention that we've seen a tremendous increase as well. And we have a lot of things going on that are supporting healthcare at this point. A special grant that will help students score higher on the T's as they prepare to go into the nursing program, as well as a boot camp for the first year of nursing, so that the students who maybe would be struggling will have a little bit more hands-on approach and support while they're starting that first year of nursing. We want to successfully get more nurses through the program. And lastly, we have a grant from Biogen Foundation that's supporting our medical interpreter program so that we can have more qualified professionals in healthcare facilities that speak multiple languages and can support the families and the patients at the hospitals and healthcare centers. So, and I could go on. We're a part of the Smith Family Foundation too, working on surge tech and community health. So, a lot going on as always.
And Kristen, I would add that we are having some really nice, doing some nice work together around the transition to healthcare program that Bunker Hill has, which is a very, very organized program to get people ready. So when we heard about the Mass Reconnect and the free college, we knew our employees would want to go, but many of them are not ready, anywhere near ready to enter programs. So we designed programs with Bunker Hill to get people ready to be surge tech, rad techs. Takes 1.5 to 2 years to do that. And it's been a really good working collaboration. We have almost 200 people enrolled at this point, and more to come. But I think that's a big piece that we have to be able to get people ready to get into the college programs that can actually deliver some, family sustaining income. So thank you for that to Bunker Hill as well.
Yeah, and it's great because we meet with MJ's team every week. So this is a really, hands-on project between Bunker Hill and MGB, and I'm really excited about where we're seeing some employees/students go in that initiative. I also wanted to mention we have a biotech or med lab tech program that we partnered with MGB on. And that's funded by the City of Boston, or Office of Workforce Development, and that is helping students get into phlebotomy and into med lab certification. So if you're a Boston resident or a Boston resident who would be interested in that, reach out to me because I can connect them to that opportunity.
I'm just going to add, Ashley's prompting me, that we've been also very active in the non-credit side of the house, which is where we do our certified nursing assistant training. And we complement that with ESL That was very largely funded by what was called the Education and Training Fund, and it was at all 15 community colleges. And this was state money it was ARPA money, actually, that was funding mostly non-credit, some credit, workforce training programs. And it was great because we got, I think it was a total of 5,000 students through CNA and some other programs.
Yeah.
That money dried up,
Mhm.
and the state did not refund it in the present year's budget. We pushed, we begged, we prayed. No. We've continued the work at many of the colleges through other funding, but it's much more catch as catch can. So at Mass Bay, we've been able to get some private foundations to fund it. It's not at the same scale. So of course it's frustrating because we were able to provide that education for free. Now we have to charge people. We're augmenting it with the funds we get from nonprofits that are helping us, foundations. But it's that's an ongoing challenge, and we will be pushing very hard in next year's budget to get that funding refunded again. One of the things that is frustrating about the loss of that money and the fact that Mass Educate and Mass Reconnect will not fund very short-term programs like phlebotomy and sterilization programs. That's often the stepping stone for students to get started in a pathway, the non-credit, the one-semester programs. And it's just so ironic and frustrating that those are the ones where the funding has now lapsed.
Yep.
Or is not provided. So we'll keep pushing for that.
Yeah, it's been a crime, actually, I think, because we serve so many students in the non-credit healthcare space, and with phlebotomy, EKG training, medical interpreter, CNA, and so, and when you build something like that, word takes a while to get out, but now we have so many people trying to apply for that program without the funding, and it's unfortunate that we're in this situation, but thanks, David, for bringing that up, because that really put a lot more people in the field and trained healthcare workers, and now it's gone. So we'll just keep working at it to get some funding back for it.
This is a great conversation, and I love, again, seeing the collaboration between across lanes and across schools. Are there any other colleges on space that'd like to give any updates? I think it would be great to hear from anyone else in the meeting of what's going on that's new. There's so much going on that's new in the college front.
I have a question too, MJ. My hand's up. I don't know if you saw.
Sorry, Harneen, please. Yes.
Thanks. So this is really helpful to hear. So thank you, both the colleges who've spoken so far. I come here as a member of this workforce collaborative running a big labor management healthcare workforce fund, but also I'm on the board of higher ed. So it's just very helpful to kind of hear on the ground level as we head into our board of higher ed retreat and planning session, thinking about the funding and strategy and how we're moving forward, particularly in this area with the whole nurse project that Joanne talked about presenting at the Mass Workforce Investment Board as well. But one of the questions I have is around how the schools are managing this new expanded population, because what I've been hearing is that while the funding is available to support the student in terms of waiving their fees or tuition, a lot of them using Pell Grant anyway, but they're able to go to school. But the impact on the schools of having a new expanded student population, many who are, older returning learners, people that come with all kinds of needs and situations. They're new learners. They haven't been in school for a long time, that we haven't been building out our school supports to be able to support the students. So there's issues around success and continuation, being able to provide what's needed for this new population that the schools haven't had for a while. So I'm just curious how you're managing that, Dr. Padel at Mass Bay.
Everything you said is true. It's a challenge because the enrollment is up and the need for supports in order to ensure students are successful were not funded. The Boston Consulting Group that did the study that preceded this did recommend that funding, but it wasn't in the state budget at the end of the day. We're doing our absolute best. And I also should note that although we should get more funding to support students in all these different ways, including basic needs supports, which is important, by which I mean food and housing and transportation, but also tutoring and counseling and advising. While we should get money for that, one thing to balance that against is that with increased enrollment, we will get additional funds from the state, as we would have through tuition and fees if we were collecting them. And also, even though our enrollment is up, it's only up as to the level of fall 2018. It was much higher in years prior to that, in the post-recession, Great Recession years, 11, 12, 13, 14, 15. So I just put it in perspective. I don't want to say we don't need more support, because we do, but before we panic, I just want to note that more students means more revenue for colleges, which means they can ultimately hire more people. So it's a qualified yes.
Anyone else? Any more academic partners want to weigh in? This is really interesting, great conversation. Appreciate it. Okay, hearing none, moving on.
Well, yes, we are. Thank you. Thank you, Dr. Patel. Thank you, Kristen, for jumping in. Really helpful to hear all those perspectives, and Harneen, really glad to have you here listening with this new role of yours on the Board of Higher Education. So thank you all. We're going to end early, unless anyone has any big announcements, but thank you all for attending. Really quick, just two things to highlight. As Dr. Patel mentioned, we're excited after feedback from all of you and others not on today's call. We heard you. We know we want some in person occasionally. So we're excited to head to Framingham on December 6th. I did make a note on the newsletter. I'll continue to highlight on the newsletter that the previous link where folks registered for the Zoom meeting that was previously scheduled for December 3rd, it's now updated to reflect December 6th, and it's an Eventbrite registration, so we can track how many folks are coming in and provide some pastries and coffee for our in-person meeting at Mass Bay on Friday, December 6th. So if you haven't registered for that, please do. Again, it'll be on the newsletter. As of right now, we have Jay Prosser, who's the Executive Director of the Nursing Council on Workforce Sustainability for Massachusetts, who will be presenting on some of new data that they have, especially around LPNs and looking at the nursing career pipeline. And then hopefully pending the state board meeting that Joanne mentioned at the top of today, we're excited to listen in on that, hear more from the Executive Office of Health and Human Services, and if applicable, which I would say is very likely, see if we can get some representation from them to also join us on December 6th. Also to really meet many of you and to better understand or strengthen the partnership and connection between our consortium and the work of Health and Human Services. So again, please register. And if you have any, as always, if you have any programs or news that you ever want to highlight in the newsletter or at a meeting, you can always reach out to me directly, or we always have a standing link on the newsletter where you can fill out a form to inform us of any new programs or highlights to showcase. So thank you all for your time today, and I hope you have a great rest of your week and a great weekend. Happy fall, y'all. I can't believe we're there. My goodness.
Bye, everyone. Have a great day.
Bye. Thanks, Ashley.
Bye, everyone.